and welcome. I'm your host, Ambassador Edward Prokopo, CEO and founder of Shiba's Holistic Health and Services. If today is your first time on this channel, we'll say you are absolutely welcome. On this channel, we discuss a lot of things, but predominantly we discuss about natural health. How can one take care of own health naturally? Your health is your wealth. Your health is your power. Nobody is responsible for your health. Neither the government, neither the pharmaceutical drugs industries, food industries, doctors, health workers. They are not responsible for your health. They are only providing services for you. When it comes to your health, you have to be radical. You have to be realistic. You have to be technical. It is your health. It is your system. Everything folks tell you to take in your system. What happens if you get blocked in the system? Who do you turn to? Who do you hold responsible for that? This video will discuss the side effect of mental health medications and how to heal yourself naturally. You are welcome.
Coming up next on Primary Care, depression in black men. Many suffer in silence.
We are alone at the very time that we really need to be reaching out to others.
Hello, and welcome to Primary Care. I'm your host, Dr. Lonnie Joe. Depression is one of the most common mental disorders in the United States and affects an estimated 17 million people each year. Black men are just as likely as anyone to have depression, but less likely to get help for it. Left untreated, depression can lead to chronic conditions like diabetes, high blood pressure, sexual dysfunction, substance abuse, and even death. According to the Centers for Disease Control, suicide is the third leading cause of death for African American males aged 15 through 24. Black men can no longer live in silence and in the shadows of this treatable condition. Here to shed more light on this topic is Dr. Harold Woody Neighbors. Dr. Neighbors is a CS Mott endowed professor of public health at the Michigan State University College of Human Medicine. His research focuses on developing community-based programs that improve the health of black men. Dr. Neighbors, welcome to the program. Thank you for joining us, Woody. Excellent. Black men seem to suffer disproportionately from the disease. Black men. Why?
But I have to say that we, more than any other group, are not getting the help that we need.
So the
and
results
not getting
of it
the help
stands
that
out.
we deserve.
Good point. So the results of being depressed stands out because it's untreated.
Exactly. So I think the question that comes up is, why won't black men seek help? I mean, it's just that simple. Now that's a general problem for all men. And it's not just for depression, it's for some of the other conditions that you mentioned, diabetes, hypertension. We have a problem in reaching out to get the help that we need.
When it comes to this disease state of depression, where does the role of the church come in, the role of the pastor, and this interaction with black men? What role does that play, and where does it come in with African American men?
Well, to be honest, I wish we knew more about that question. It does come into play, but the problem is that we as men are probably not revealing our stress to our church members, to our family and friends at the level that we should.
That's very true, because we see so many people in the family come along and say, I didn't know he had this problem.
Yeah, I mean, when you say something like that, it reminds me of Don Cornelius.
Yes, Soul
Train. Everybody
yes.
watched Soul Train, I mean, all the time. Don Cornelius's son, Don Cornelius committed suicide, unfortunately. His own son said those very words. I did not know my father was in such pain.
Antidepressants, which are numerous. Some of the most prevalent ones include nausea, increased appetite and weight gain, loss of sexual desire and other sexual problems such as erectile dysfunction and decreased orgasm, fatigue and drowsiness, insomnia, dry mouth, blurred vision, and constipation.
My name is Peter Gertje. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30, or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on.